Thank you for staying with us. Now to our interview portion. As I told you earlier, the 10th of October 2024 is Mazingira Day here in the country, but the world will be marking World Sight Day. And of course, Kenya will join the rest of the world in marking that feat, as well as the theme this year will be Love Your Eyes and Children. We are here with an optometrist. He will tell us why the focus will be on children as opposed to the rest of the populace. Now, he is from the Optometrists Association of Kenya's plans, and of course he is the president of that association. Victor OPIYO, thank you for joining us this evening.
Pleasure, Shim.
Maybe we start on that premise. Why is the focus on young ones alone this year?
Basically, the focus is on young ones because we thought they are the foundation of the society. And as I was watching, you were taking us through the news, I've seen there is also some point whereby we talk about stigma. Yes. So there is stigma when it comes to the conventional way on how we correct some of the problems that they have using the glasses. There is also a problem that most of the time these kids, you find they don't speak out if they have the eye problems. So that's why we are trying to make noise that we need to do capacity building to a few, like the mothers, the teachers, to support these kids with ocular problems. Yeah, you understand? Then the other thing is we are, as a society nowadays, you find the kids are doing a lot of e-learning. We don't eat healthy, so we are predisposing these kids to some of the things that are very harmful to human eye. The electronics, the diets. You take an example, most of the time nowadays we are doing e-learning. We are introducing them to e-learning at a very early age. We are eating junk food, which is a predisposing factor to some of the diseases at a late stage. Example, hypertension, diabetes, and etc. So we thought as a community that this is a time that we can make noise, since all the agencies are ready to listen to us. And also, the kids also, when they grow up, there is how they'll influence the economy positively, you see. Yeah.
And of course, give us some statistics if you have your association that has interacted with, but tell us what are these conditions they are likely to suffer from most?
According to our observation and a lot of research that have been done, most kids have been going through a lot of eye problems, ranging from refractive errors. Refractive errors are examples of them are nearsightedness, farsightedness, and astigmatism. I see you are wearing on glasses, so yes. I think you have a bit of clue. Then also we have some eye problems like that are caused by infection, allergies, whereby you spot a kid constantly rubbing the eyes. They want to sit next to the board. There are also the likes of the lazy eye, the squints, whereby there is a misalignment on the eyes. There are a series of diseases that affect these kids, and they go unnoticed because this kid at an early stage cannot compare him or herself with another kid. So they're normally not interested. So they just feel that whatever they are seeing is the normal. Yeah, you see.
Now, what are some of the measures that have been put in place to address these kinds of issues that you are seeing within the country?
Within our Kenyan per se, what we have done is number one is what we are trying to do. We are trying to create awareness, and you remember World Sight Day coming the week we are starting is an arena for advocacy, so that government agencies, the policymakers, can take kids' vision issues serious. Number two, we are trying to do capacity building, and capacity building comes in terms of, at least, you see, we have the community health promoters. We are trying to educate them to understand some of the behavioral and how to support kids with eye problems. Also, as a society, we are having conversation with different players in eye care that can support some of our screening programs whereby we go to a school X, do screening to these kids, and give a pair of glasses at no cost. And if we find cases that are so complicated, we have to refer to specialists. You know, as a profession, we are not alone. We are different cadres within eye care. So all that incorporated, and all system workings, and I appreciate that what is happening with our current social health insurance. You have seen there is a cap they have put for people less than 18 years, under 18 years. So it means that even the government has seen that there is essence to invest on the kids' vision. Yeah.
Now, how do you bridge this gap there? This household that doesn't have SHA or doesn't have a private insurance to cover their optical needs. So to ensure that those people are not left behind, because you see people who come from poverty or from the slums, they have to balance between buying food and getting their children to receive this medical care. So how is that vital, and how are you breaching that gap?
So as a society, that's a very good question, Hashim, because you know, even if you look at how our distribution is in terms of professionals, you will find most of us are within Nairobi. So the peri-urban areas, like for say somebody in Turkana, somebody in Mathare, who cannot afford the conventional way of correcting some of these problems, they're having difficulties. That is why we are saying we are trying to create access. And how can we create access? We create access by taking these services next to them, and either offer these services at a free cost or at a subsidized cost. And as an association, we are trying to promote this by elevating the status of optometrists in this country by at least supporting them to open access points in those peri-urban areas, you see. By doing that, we will make sure that we carry along these kids, a kid that is in Turkana, and make sure that this kid can be in school so that we don't lose that school time, you see. And also we have realized that some of these eye problems can even affect a kid's performance. So whatever you are saying, whatever the question you are asking is very, very relevant, and we have done many measures towards making sure that we create access. Number one, you create access, and you have to make sure that the services are available. You know, there is a difference of creating access and it is not available. Yeah.
And of course, given that we are going to celebrate that day on Thursday, the 10th of October 2024, what are some of the challenges maybe you have witnessed as an optometrist in this particular sector, and how can it be addressed?
Some of the challenges that we have witnessed as optometrists in Kenya, number one, we are struggling with the human resource in eye care. You take an example right now, we have less than 620 optometrists. We have less than 200 ophthalmologists who are specialists, those who offer surgeries at tertiary, they are at tertiary level. So deficiency in human resources. And the other thing that also we are fighting through, another problem that we are going through is the training of our curriculum is not properly harmonized, so that there is a proper channel that somebody from a diploma level can upgrade, you see. Then if you go to these hospitals, like you look at what is happening with SHA, they are saying that the services of an optometrist should begin from level 2 to level 3. But if you go to these hospitals, will you see an equipment? We lack equipments and consumables, you see. We have a clue of what we want to do, but implementation is not there. Yeah. And again, the other thing that now is coming up, and this follows up the question that you asked, that how can we make sure that these tools are accessible to these guys? Take an example of what is happening with SHA. They are saying that a pair of glasses is 935. And I'm wondering, even if we are talking of ways of how we can reduce, we can make these tools accessible, but the policy system is not favoring an optometrist, you see. Yeah. But all around, what I'm appreciating is, as a nation, our government is ready for this conversation, and they are taking those small baby steps. That is the number one thing that we have to appreciate. Yeah.
Maybe what are those gaps, especially in policies, maybe your association or other optometrists in the country have forwarded to the government that will address some of the gaps you're witnessing right now?
Some of the gaps that need to be filled. Number one, optometry as a profession. You have to know that optometry is an independent cadre, that it is educated and has to be regulated. So one of the things that we are facing, one of the problems that we are facing is there was lack of regulation. We have an umbrella we have an umbrella regulation with the Kenya Health Profession Oversight Authority currently. Then we had, for you to offer your services to, for say, a county hospital, for say in Kiambu or in Turkana, you also have to have a scope of practice and a career guideline. I'm glad that as a society, these are things that we have pushed, and we are just waiting for an example of license that is we have done. We have licenses, scope of practice. We have for eye health, and our career guideline is yet to be approved by Public Service Commission. It is undergoing some last streaming. It was approved, but we are still waiting for a written approval letter. So you see, once you have all these in place, we can create access. We can say that when you go to level 2 in Makueni, you'll meet an optometrist. Yeah. So, but all this, I'm glad that there are things that are on the tail end, so that a mama mboga in Turkana can have a eye care next to her. Yeah.
And of course, given that you've clearly stated that there is a shortfall when it comes to human resources, so as an association and other optometrists in the country, what have you done to ensure, especially in the curriculums we have in the country, you do know about the KBC, the institutions of higher learning, what have you forwarded to those institutions to make this area attractive so that many people can study under optometry and at the end of the day they go into the job market?
Yeah, you see what was happening initially, people never understood the scope of an optometrist. So number one key thing that we had to do is do a lot of advocacy. And this advocacy, we are doing it in many ways. The media, we are using the stakeholders to preach the gospel, to understand the scope of an optometrist. Then I can marry that with the training institutions. You find we only have, currently in the country, we have 3 institutions training optometry. But if you look at the current trend, the past 2 to 3 years, what has been happening, the uptake has increased. So that means that we are trying to address the gap on training, on human resources through training. We are also trying to reach out to the likes of community health promoters, to equip them with basic knowledge on some of these eye conditions. And as a society, the basic thing is we are trying to make sure that these professionals undergo proper training, so that when you meet somebody in Mandera as an optometrist, is somebody who is qualified and ready to serve you. So in terms of training, we have done a lot. In terms of advocacy, we have done a lot as a society. And also in terms of creating public awareness, so that this kid that is leaving Form 4 can know that this is optometry and this is what an optometry does. Yes.
And of course, to the young ones who are watching you right now, they're in their 4th years, they're concluding and they're studying optometry. Will they get jobs at the end of the day in the sector?
Yeah, at the end of the day, there is always hope. What we are trying to do is to make sure that we get it right. And getting it right is going through the right channels and putting policies that are strong. So my promise to them is optometry is a cadre that is still young in the country. Opportunities are there. The only thing that we request from them normally is, as much as they enter into the field, they have to make sure that they understand the art and the science of what they are doing, and they make sure that they're ethically and professionally right. So that, you know, when you come to me and you get a good services from me, it will be easy to preach the gospel, even to a minister somewhere. So you see, by that we'll be increasing the numbers in our pool. Yeah, so the hope is there.
And of course, we have seen so many doctors, fellow colleagues that are in the profession of, when it comes to the health sector, who have opted to work in other countries as opposed to here in Kenya. So has that been similar to your sector, and what have you done to ensure that these people remain in the country? At the end of the day, we don't suffer from brain drain.
Yeah, that is a challenge that has been affecting eye health in general, and more so at the specialist level, those who are at tertiary level. You find them migrate to other countries for reasons well known to them, maybe greener pastures, most of us normally say. But optometry is a new cadre still, even in Africa. So labor migration is still minimal. The only thing that we try to do is make sure that, you see, take an example of the career guideline. When we are working on our career guideline, we make sure that the entry level are lucrative, so that this person, we can contain him or her within the country. Yeah, but we have a few optometrists who are expatriates in other countries. I know a bit of them, but we have tried to make sure that we contain them in our country, so that they serve our people. You see, the number is very low, and the population that we are serving is over 56 million people. So we have to make sure that we contain them, no matter what.
And in just 30 seconds, what can we look forward to, given the day is on the 10th of October?
What we look forward to on 10th of October is, as a society, we'll be doing a screening, and we'll do eye screening at Mukuru Promotion Center, which is running 6 schools with a population of 7,500 students. So what we are trying to do is we are trying to use that as a study area, so that we can come with data to inform the government on the burden that is there on eye health issues. And on the same note, we're also trying to make sure that we at least do capacity building to the teachers, so that when you take your kid to Mukuru Promotion Center after a year, a teacher basically will have some clue on how to spot a kid with an eye problem. Yeah.
Okay, thank you so much. That is Victor OPIYO, the president of the Optometrists Association of Kenya. Thank you for making time for us this evening. And there you have it. We're looking forward to the 10th of October 2024. Aside from being Mazingira Day here in the country, it will be World Sight Day, and Kenya will join the rest of the world in marking that particular day. That concludes our bulletin this evening on Sunday Express. My name is Abdiaziz Hashim. The sign language interpreter at the bottom of the screen is Baron Abuli. You can always find more on our webpage at www.kbc.co.ke. Enjoy the rest of your evening.